Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with bilateral occluding earwax. In fact, I will say that their right ear was semi-occluding. This is their left ear, this is the worst out of the two, and this is fully occluding. So the earwax is completely blocking the view of the eardrum, and it's up against the canal walls. So this outer part of the wax plug, it's got a soft layer, so the patient had been using some drops, and the deeper section of the plug was a lot drier, so that's where the drops hasn't been able to penetrate. And around the edge, this patient's got a lot of dead skin, and this skin is enveloped itself around the wax plug, and it's still adhered to the ear canal wall. And you probably can see that as I'm wriggling this wax plug, you can see some skin adhesions at the bottom slowly breaking away. So I'm just using this rocking motion to release the plug off the canal wall, and we've got the outer section out. And when we've got a medial plug of really dry hardened earwax here, that's matted, you can see a lot of hair there, and those hairs shouldn't really be there. The hairs in the ear should only be located on the outer third, the cartilaginous portion. I'll come back to that in a moment. Before I attempt to remove that more deeper wax, I'm just peeling away the skin. So this skin, as I was entering with the suction probe, it was catching the tip of the suction probe. So we were getting some clarinetting, some loud high frequency squeal, and that's when dead skin, as it's attracted to the vacuum, it flaps violently. So to prevent that from occurring, I'm just peeling away the skin. I'm just using a fine end suction probe because we're far less likely to experience clarinetting, and if you do, it's at a more comfortable level. So I'm just clearing the way, and once I've removed the majority of the skin, I'm going to go back in with the full zone of suction probe, because I'll require the full power to remove that more deeper wax, minus the clarinetting. So yeah, the outer third of the ear canal, the cartilaginous portion, the skin that lines that section of the ear canal has three layers. We've got the epidermis, which is the outermost layer, with that's your protective membrane, if you like. And then you've got the dermis. Now, the dermis is the middle layer, and that contains collagen, elastin, but importantly, the hair follicles and the erectile muscles, which help the hair strands, once formed, to erect and protrude outwards into the ear itself. And then you've got the deeper layer, the subcutaneous layer, which is a layer of connective tissue and insulating fat. The inner two-thirds of the ear canal, it only has the skin that lines the bony part of the ear canal. The inner two-thirds only has the epidermis, so it's missing the dermis layer. And as such, there shouldn't really be any hairs growing in the inner two-thirds of the ear canal. And you can probably see the boundaries. So if you look at the complexion of the skin here, it's a lot more red. That's because you can see the blood vessels and capillaries, whereas the skin that lines the outer third where we are here, it's a bit paler because the skin's a lot thicker. You're not seeing the blood capillaries as well, the blood vessels. And of course, bone is a lot more rigid than the cartilage, so you're getting, it's a bit more of a shinier, glossy appearance of the bony section of the ear canal. So I'm just using the finer, I'm just mopping up a bit of dead skin as much as I can without causing trauma to the patient. So I'm just peeling this back towards myself, trying to separate that skin. You can see these hairs, the majority of the hairs protrude from the back part of the ear canal, in my experience. You can see there's a few whiskers there. That's the patient's eardrum. It's dull, you don't have the light reflex, but it's functioning fine, it's fully mobile. So the right side, the wax is a lot darker in this side, and also the dead skin as well. There's a lot more hairs here. And because the wax is darker, I suspect it's been there for a bit longer. It's oxidized, it's matured. Just like an apple, or an avocado. As you cut into it, you get a blackening due to the oxidization process. So here you can see the eardrum in the distance, the superior aspect, the top part. So I'm just peeling away from the base of the ear canal. There's a lot of dead skin here again, as you can see. Slowly but surely we're revealing more of the ear canal, and that's the eardrum, it's fully visible. And I'm just going to spend the next few minutes just peeling away a lot of dead skin, particularly from the back section of the ear canal. I'm going to use a Jobson horn to almost scoop away some dead skin. With the Jobson horn, we only use that on the cartilaginous portion. And you'll see if we attempted to make contact with the bony part of the ear canal in the same way we did the cartilaginous portion, it'd be very uncomfortable for the patient. We'll use some forceps just to peel this away. You can see how matted it is. Again, that skin's quite thick. Well, we could have left it like this. So when we're training our clear wax delegates, especially when they're new and they've got no previous experience, this is fine. So when patients attend earwax removal appointments, what we want to do is alleviate them of their symptoms, and just by revealing some of the eardrum and ear canal, that's going to help improve their symptoms. As you get more experience and comfortable, and you're better at what you do, because that comes with experience, you can then start peeling away some of this dead skin and keratin that's catching the canal wall. There is a bit of a loose hair there. I don't know if that comes away with the suction. We shall see. It's interesting, when I'm performing the procedure, I'm not always aware of these loose hairs. Especially when I watch the video back, that I notice these hairs, and that's probably subconsciously me realising that these hairs are not really important. That's not what my objective is. But it's quite interesting. So there was a video a few weeks ago where there was a hair that was stuck to the suction probe as I was vacuuming, and when I was watching the video back, I could just see there's that hair. But during the procedure, I just wasn't aware. I was completely oblivious to it. So, and I suspect that's just my mind focusing on the main objective, just clearing the wax. We all have a bit of hair on our ear. It can go loose. It doesn't affect us at all. Only once I had a patient with a hair that was up against it, well, the tip of the hair strand was rubbing against the ear canal, and they could feel it. But otherwise, it's completely fine to have a few hairs here there. I've got quite a few hairs in my ears, actually on the eardrum as well. So the eardrum is slightly sticky, and so on my my eardrum, sorry, there is a few hairs there, but completely oblivious to it. So I actually moved that hair. I think it's still in the ear, but I just, unknowingly almost, moved that. So this bit was a bit, now we're on the boundary of the cartilage and bone, so we're going to be a bit gentle here. I'm having to leverage this. This is quite crusted. So just rotating the Jobson horn as I'm coming out of it, of the ear with it. I think there's going to be some residual debris left, which is fine. Again, as I alluded to earlier, when we're removing earwax, it's not about getting every little last speck. I would definitely not be doing this on the bony part of the ear canal for sure, but because on the cartilage, it's not a problem. It's not going to cause them any major trauma. Well, I hope you enjoyed that video, guys. Do take care, keep well, and speak soon. Bye.